Welcome to Spicer and Company. I'm Sean Spicer.
And I'm Lindsay Keith. Well, it's been an everyday occurrence that we see crowds gather and protest. But in these calls for social justice, are we letting down our guard on social distancing?
Yeah, it's been over 2 weeks now since the protests began in the wake of George Floyd's death. And here in D.C., over the past 24 hours, it's been unbelievably peaceful. But interestingly, the danger now isn't necessarily the violence and the rioting it was a few days ago. It is now something that we can't see, the potential spread of COVID-19 throughout these crowds of protesters. We already know that members of the D.C. National Guard who were at the earlier protests to make sure that all the peace was kept have turned up positive for the disease. Yet in the face of continuing demonstrations, public health officials who have warned us about gathering in large groups, attending church services, now are suddenly saying that social justice matters more than social distance. And for months, health experts told Americans to stay home. Now many of them are encouraging to join mass protests. Moreover, it's a message echoed by media outlets and some of the most prominent health experts in the country, like former Centers for Disease Control and Prevention Dr. Tom Frieden, who loudly warned against efforts to rush opening back up the economy, but is now supportive of mass protests. Their claim, they being public health officials, say that if we don't address racial equality, it will be that much harder to fight COVID-19. Now they are saying there's also evidence that the virus doesn't spread easily outdoors, especially if people wear masks. Doesn't that go against everything the public officials have told us since the spread of the virus to begin with? Weren't we told that the virus is highly contagious, which is why there was a nationwide shutdown for nearly 3 months? And secondly, why the sudden about face from these medical experts? Have we been lied to all along? What's worse? What's going to keep us safe? I mean, it seems like it shifts now. Well, here to break this all down is Congressman and physician Dr. Michael Burgess of Texas. Congressman, welcome back.
Hi, Sean. Thanks for having me on.
So before we get to the protest, what's happening there, I want to ask you what's going on with the WHO. Everything that we are doing and so much of what's happening in society is somehow tethered to the guidance coming from the WHO. Our own government health offices use their guidance. And it seems like every week, if not every day, they change their tune. First, it was masks matter, then they don't matter. Now they're saying that they're relying on a bunch of studies regarding asymptomatic people that aren't very big. And that was the big issue with all these earlier drugs. They said you can't indicate what to do based off studies that aren't statistically significant. So what should our country be doing? Because clearly the WHO is no place to look for guidance.
Well, look, I think both stories that you've now referenced probably partly the same story, and that is this virus is a brand new disease. It's a novel disease. It was not known before the first of this year. And as a consequence, a lot is being found out about it. I also was somewhat confused by what the World Health Organization has come out with. It seems like some contradictory statements in the past couple of days. Yes, I think some of the other statements that were made as far as the abandoning of social distancing during a useful protest, I don't know if that's really good advice. I mean, after all, social distancing is the one thing that we know that works. If you really do want to flatten the curve and prevent a surge and overuse of hospitalization ICU beds, social distancing is probably the most effective tool. Other than not going to work sick, I guess would be a second one. But look, it is clear that there are people who are testing the boundaries, both people who say, look, I'm sick of being shut in, and people who say, I've got an important protest to conduct. So I guess, in a way, we're seeing an interesting juxtaposition of experimental data, and perhaps some smart person will tell us at the end of it what the right answer was.
But here's the thing. You're a physician, right? When I go to my doctor, I want them to, they tell me what I need to do to stay healthy. And I'm now seeing these contradictory information. To your point, they've told us socially distance, put a mask on, and to the extent that you don't have to, don't go out if you don't have to because you don't want to spread it. If you go out, bring it back into your household, you could be infecting your family, your elderly mother or father or aunt or uncle, right? So I get the need to protest. There are people, this is what makes our country great. If you feel that you have a cause that you care about or change that you need, that's why our country is the envy of the world. Go out and do it. But if we send people out to protest and tell them it's okay, and then they infect other people or themselves, we're doing them a disservice and we're harming them. And so I just don't understand how government officials can tell you one day, here's what you need to do to stay safe. And then the next day say, what we just told you doesn't matter if you want to do the exercise for a different thing. What's the difference between going to church and then saying, well, wait, let's not call it church anymore. Let's call it a protest and we can go there. That seems silly. Now you're arguing over semantics.
Right. So, protest every Sunday morning. It's the hour to do it. Look, it is a new virus, and there's data coming out all the time, and people are adjusting. I think you've seen even some of the most significant public health experts in this country that appear with the president from time to time. I mean, their recommendations have changed over time. What in early and late January was not something that we need to be concerned about here in this country, to the point that, as you made, we had to shut everything down in the middle of March and really do violence to our economy.
Let me ask you.
All those things are important, and look, there's also the potential for a second wave of this.
Right.
No one knows how the real risk of that.
So we've been cooped up for a while. I think kids are getting sick of their parents. Maybe some parents are getting sick of their kids. We've been dealing with all of this racial unrest that's occurring right now. People are out there protesting. They're upset. They want change. You've got cops that are being attacked, National Guardsmen that are moving around. June is Mental Health Month, and reports indicate that there could be 150,000 deaths blamed on mental health and substance abuse because of all this. I know this is something that you've been out and outspoken on, but I think between the confluence of these events, there's going to be some serious mental health toll that society takes.
I don't think there's any question about that, and that figure that you used, 150,000, is one that I've heard also, and it's somewhat ironic because that is greater than the total number of deaths that are attributed to the coronavirus right now. And this, of course, includes suicides and mental despair by whatever context you want to place it in. Alcoholism, even automobile accidents to some degree can result from the mental stress that has been brought about by the closed-in phase that we had on this pandemic. Right.
Well, there's so much to talk about between the inconsistencies of our health officials. I get your point, by the way. But if something's wrong and it's not good for our health, then it shouldn't matter whether we should be able to give people better guidance, because that part has not changed. But I appreciate you coming on and sharing both your government expertise and your medical expertise. And I look forward to having you back soon.
Great. Thanks, Sean.
You bet. All right. Well, if the conflicting message from the U.S. health officials on the spread of COVID-19 isn't enough, the World Health Organization is now walking back their statement on asymptomatic spread of coronavirus, which also contradicts the CDC guidelines. Coming up, though, we've got political commentator Trish Regan to break it all down, and later, political strategist Dick Morris on his latest column, The Truth Behind Police Killings. All that and a lot more.